So, to begin, the topic of wellness is bounced around a lot in regards to one's health. So, what really does wellness mean? A person in good wellness is said to extend past that of just good physical health. It also includes mental health. The Substance Abuse and Mental Health Services Administration has an 8 dimension model that includes emotional, environmental, financial, intellectual, occupational, physical, social, and spiritual wellness. The overall concept of wellness can be influenced by certain social practices. The social practice of finding one's sense of meaning or purpose is said to often drive the person socially to seek out other people that have common beliefs or values. This assists the individual in connecting them socially. The social connectedness can often generate positive results, such as enhancing the individual's overall sense of meaning. So, not only does this process help the person connect to other people, but also gives them a greater sense of purpose. The idea of wellness is not a new one. From the early development of wellness that has been linked to ancient Greek medicine, wellness has had many approaches from several different disciplines. Both chiropractic, osteopathic medicine, and holistic practices are other different avenues that the reaches of medicine have developed from and into. Even though some advances of medicine and technology are seen as new, the overall idea of wellness has not changed much since its early days of development. So, being that the overall concept of wellness has really not changed too much, the world around us sure has. Increasing rates of chronic illness and obesity are just a few areas where the lack of importance and attention to wellness, among other issues, in the overall population has led to drastically increased rates. Improvements to the prevalence or decrease of these problems could happen if wellness would be able to gain importance within these populations. With the overall lack of importance being identified as a contributing factor in certain health issues, and a costly one at that, both the Affordable Care Act and the employer wellness programs have begun work on integrating and promoting wellness. This new wellness promotion has been used in targeting a change in behavior in relation to the aspects of overall improvement in a person's wellness. As a respiratory therapist, I treat a vast array of different types of patients. One specific patient population that I treat are COPD patients, chronic obstructive pulmonary disease. One aspect of the screening that I do for them is to see if at home if they become short of breath. Often patients due to shortness of breath will do less activity, which is detrimental to their wellness and health, so we try to promote being active, even if that means wearing oxygen. There are both positive and negative aspects of wellness. The positive aspects of wellness include people developing healthy lifestyles and the ability to provide self care or the act of taking care of yourself. Negative aspects include the terminology that sometimes accompanies wellness. One specific term, alternative, as it relates to medicine or wellness techniques. Another negative would be the skepticism that accompanies providers of such alternative approaches and are often questioned about those different approaches. There have been recent studies that have found positive effects on long-term societal wellness as it relates to the developmental factors of children at a young age. Introducing children to wellness at an early age is very important. Emerging technology has really come a long way as it relates to societal wellness. As seen here on the slide, there are many wearable devices and applications that can be used to support a person's wellness. Applications can be used on smartphones. The future of wellness has so much to offer from the new technologies that can be used towards personal and societal wellness, as well as from the data collected from these devices. No matter how you look at it, excessive alcohol use has a negative impact on wellness. There are said to be 88,000 deaths per year related to excessive drinking, and of those lives that died, they are shortened by an average of 30 years. The main population affected or targeted are binge drinkers, heavy drinkers, and any drinking done by pregnant women or people younger than 21 years old. we will mainly be looking at the younger population. There are short and long term effects on the topic of excessive drinking, and negative effects on wellness are decreased physical, mental, and spiritual wellness, just to name a few. Amazingly, people aged 12 to 20 years drink 11% of all the alcohol consumed in the United States. A 2013 Youth Risk Behavior Survey shows the impact among high school students during a 30-day period. 35 drank some amount of alcohol, 21% binge drank, 10% drove after drinking alcohol, 22% rode with a driver who had been drinking alcohol. In 2010, there were roughly 189,000 ER visits by people under the age of 21 for injuries and other conditions linked to alcohol. The Surgeon General says that in adolescence, the brain is developing and may be very susceptible to long-term negative effects to alcohol use. Predictions show that with the current trend, the influencing of many areas of wellness will increasingly be more negative. The CDC says that long-term wellness issues include mental health problems, social problems including lost productivity, family problems, and unemployment. Physical wellness can be impacted by high blood pressure, heart disease, stroke, liver disease, and by certain types of cancers. I recommend working on decreasing the use of alcohol in the underage population. This would increase wellness positively in the overall population and decrease the chances of early death. A strategy would be to identify and educate, working on changing the expectations of young people, and importantly their families, in regards to the negative effects of drinking alcohol. Another strategy would be to identify families that are at higher risk of influencing their children and focus on changing the perception of alcohol so future populations of the family are not affected. One easy fix would be to reduce the availability of alcohol to younger people through increased penalties and laws. Strategies include educating children and their families routinely about the negative effects of alcohol. Provide the families the hard facts that were previously discussed. And another strategy would be to use community awareness and projects to limit availability of alcohol to young people and to educate about that. Being that the targeted population is younger people, education needs to be implemented with schools to consistently screen and educate kids less than 9 years old on the negative effects of drinking alcohol to build social awareness. If kids learn that it is bad and not fun to drink alcohol, perceptions would eventually change. Another implementation would be to use the community to plan and identify areas that young people could gain access to alcohol. Benefits of doing the previously stated work would be to decrease the negative effects of alcohol on wellness, such as social, economic, and physical health. This would then benefit by decreasing the overall alcohol related deaths. My plan would be preferable because it could decrease the rate of alcohol use in young people, therefore assisting in increasing wellness and life expectancy among all people. Thank you.